So one of the shots that your baby's going to get right there from the beginning is a vitamin K shot. So why? Well, vitamin K is a vitamin that's needed to help your clotting factors be able to stop you from bleeding. Now, vitamin K we get from vegetables such as leafy green vegetables, avocados, cabbage, cauliflower, broccoli, turnips, bananas, kiwi, soybean oil. Not the normal thing your newborn's probably eating. We're going to give this vitamin K shot to prevent the spontaneous bleeding from vitamin K deficiency bleeding. Vitamin K deficiency bleeding happens at 3 times. One's early in the first 24 hours. The second is classical, usually from day 2 through day 7. And the third is late, usually 3 to 8 weeks of life. The first one is almost always because mom's on some kind of medicine, usually like an anti-seizure medicine, a medicine for tuberculosis, maybe a medicine for clotting, like a blood thinner. These bleeds are almost always in the head or in the gut, and usually are very, very severe. Your classical bleeding, that one between 2 and 7 days, is usually going to happen in oozing from umbilical sites, circumcisions, possibly some gut, skin, and brain. The late, that 3 to 8 weeks old, almost always happens in the brain and in the GI tract. It almost always exclusively happens in babies who didn't get their vitamin K shot or in completely breastfed babies. It is estimated in the United States that if we stopped giving that vitamin K shot, between 176 and about 420 babies would have late onset vitamin K deficiency bleeding. Why is that so important? Well, you almost get no symptoms before the bleeding has already happened, and it has a mortality or death rate of about 20%. So that's the reason that we give vitamin K to the babies at birth. Now, why does it happen in breastfed babies and not in the bottle-fed babies? It's because the bottle-fed, the formula babies, get about 100 times more vitamin K than is contained in breast milk. That vitamin K shot, it starts to work in about 20 to 30 minutes to start slowing down bleeding. The other thing is it's stored in the muscle and slowly leached out over the next 2 to 3 months to prevent the classical bleeding as well as the late onset bleeding. So it's a great idea, and it prevents some terrible, terrible complications that we used to see from vitamin K deficiency.